Vitiligo, likely meaning blemish, is a non-contagious skin condition that is defined by patches of discoloration or depigmentation. Though vitiligo can affect any race or ethnicity, it tends to be more noticeable in people with darker skin, like Canadian fashion model Winnie Harlow. Given the effect on a person's appearance, pigment loss can really impact a person's quality of life.
In vitiligo, there's a loss of melanocytes, or the absence of their function. Histologically, having less melanin in the epidermis results in white depigmented patches. These patches are classified by type. There's non-segmental vitiligo, which is the more common type that affects any age group, and it occurs at various locations that are mirrored on both sides of the body. There's also segmental vitiligo, which mostly affects children, and occurs in segments along a single spinal nerve, typically only on one side of the body without crossing the midline. The exact cause of melanocyte destruction isn't known, but it does seem to be linked to both genetic and environmental triggers. In non-segmental vitiligo, there seems to be an autoimmune element, where immune cells attack the melanocytes.
Oh, you killed me.
In segmental vitiligo, there seem to be neural factors, where nerves release neurochemicals that damage the melanocytes. Other causes may be that the melanocytes get damaged by a buildup of toxic metabolites as they make melanin, or in other metabolic pathways. One interesting observation is called the Kubner phenomenon, and that's when vitiligo develops in skin soon after there's been a trauma, like a cut, abrasion, or burn. The main symptom of vitiligo is the irregular, round or oval-shaped patches of depigmentation appearing within normally pigmented skin. The patches can range in size from millimeters to centimeters, and can sometimes expand and merge with other patches over time. The body hair and the iris may also be depigmented in affected areas. Non-segmental vitiligo tends to affect the hands, forearms, neck, scalp, feet, and face, while segmental vitiligo tends to affect areas of skin near dorsal roots from the spinal cord, particularly in the face following the trigeminal nerve. The diagnosis of vitiligo is based on the appearance of depigmented patches, but a skin biopsy can also be done. There are two main treatments. When the affected area is small, cosmetic cover-up and topical immune suppressants can be applied directly to the skin. When the affected area is large, systemic immune suppressants, UV phototherapy, skin bleaching, and in severe cases, skin grafts can all be tried. Whatever the course of therapy, sunscreen is recommended to prevent darkening of the skin areas immediately surrounding and contrasting the depigmentation areas, and to reduce the risk of skin cancer.